Dr. Fankhauser, do you see children in your office, young, very young children?
We do, yeah.
Okay, so...
preferably when they don't need anything.
Okay, meaning very early or so. Let me ask you, so what advice could you give to moms who just had a baby, children are growing up, in terms of when they should go to a dentist, why? Is there some home remedies they can do, something they can do when a child starts teething and starts making noises and etc., and something they should or shouldn't do while the kid is growing up?
Well, sure. The first thing you want to do is when you're pregnant, be sure you're taking the vitamins that you're supposed to, so that the baby is born healthy and has every advantage that way.
Okay.
Generally speaking, it's better for the baby if the mother nurses. But when you start putting babies on a bottle, you got to be careful to not leave the bottles in there too long, like overnight, so that when they start developing teeth, and they can get what we call a bottle syndrome, where they get decay in all the teeth because they have left the stuff in there overnight to affect the teeth. So when you start seeing teeth, start sticking your finger in around there and getting the baby used to somebody doing, something in there, so that they get used to you. Later you can take a washcloth or a little gauze, wipe the teeth off gently. Don't do anything that's going to hurt, because then the baby or the little child will resent it or object to it. So as they get old enough, you want to start. If you're in an area without fluoridated water, you want to give some fluoride supplements, so that the baby has enough fluoride to develop the teeth more strong than they would otherwise, optimally. But you don't want too much fluoride, because then it develops another problem. You also asked me about the teeth in development.
Like when is it time to go to see a dentist?
We like to start children very young, around 3 probably. And what we like to do is just bring the child in, let them sit on mom and daddy's lap in the chair, right up and down, play with the water thing, and so they kind of get used to coming. And then when we start seeing them and keeping them healthy, so they don't need any fillings, they don't need any serious problems, as they're growing up, if they ever did, let's say they get to be 10 years old, and they've been coming since they were 3, putting them in and doing a filling is not a big deal to them. They're used to it. See, it's just part of what's going on. They're not scared.
Right.
But one of the things I hate to see is, a kid that shows up, they're 6 years old, they've got a bombed out or rotten out tooth, and it hurts, and they've never been to the dentist before. You can't make that a good experience.
Right.
So,
well, I guess it's like everything else, prevent it. Yes. Right? Because, from what I hear what every dentist ever tells me is, dentistry really seems to be one of the few, if not the only medical arm where literally everything is preventable. You can't quite say that with stomach aches and headaches and stuff like that. You can do what you can do, and there's lots one can do, obviously. One can be to a high degree in control. But dentistry, it's almost like 100% control. Do what you're supposed to do, and you will have always a healthy mouth. True?
Pretty much true, yeah. You know, there are things that can go wrong. Accidents happen.
Sure.
You know,
but even
maybe
they can be fixed.
Yeah.
You know?
Maybe you got poor luck of the draw in your genetics and didn't get very good teeth, but otherwise, you know, a lot of things can be prevented.
Okay.
So
I can see that works for children, especially that getting used to it. I mean, it's with everything, you know, it's when as child, you know, it's like I know some children at the age of 7, literally they speak 4 languages simply because they grew up with 4 languages around them. And to them it's just the most normal thing. In fact, I had, when I learned French, correcting a 7 or 8-year-old me on my French, and she spoke perfect my own language, which was German, and all kinds of, I mean, she just was fluent in all the languages, as fluent as a 7 or 8-year-old can be, but in terms of vocabulary, but because they grow into it. And so that's basically what you're saying. Get the child growing into it, and it being normal, and don't make the first experience something where you need to do a tremendous amount of work on it.
Right.
Good. Now, as the teeth are coming out, is mom anything she can do for making the pain less painful for the child? You know, is there any some easing, some gel, is there stuff like that out there?
Well, yeah, there's a variety of preparations that you can get that will kind of numb the gum tissue. You don't want to overdo it, but you know, it'll help. It's part of the process of growing up. You know, they're going to have to learn to deal with a little bit of pain sometime. They fall down
my growing pain hasn't stopped yet. Be it in business, be it in God only knows what.
Yeah. You know, if they skin their knee, it's going to hurt.
Yeah.
So.
Okay, good. So there are some stuff out there, but common sense. A big thing I got out of it, don't let the baby sleep with a bottle of milk or anything like that, because, well, that would resolve, like, not only not brushing, but it would kind of like soaking the teeth in there with especially like in a young age, it's usually milk and stuff, and it gets hot.
Yes.
It gets acidic, right? So
you get too much acid in around the teeth, and it's going to eat the enamel off.
Sure. All right. Thanks, Dr. Fankhauser. Thanks all about children dentistry here.